get it correct. Is your name pronounced Tara or Tara?
Tara.
Tara. Okay, sorry, I got it wrong the first time.
That's okay.
Hey, thanks for making time so late. You know, I know it's a little bit late, and you've probably had a long day of driving and checking out the facility at Blueberry School, so I don't want to keep you too long.
It's okay. Actually, as a mom, I'm in a hotel room, so this is a great night for me.
Yes.
Relaxing night away from the kids.
How old are your kiddos?
They are 8 and 11 now.
Oh, okay, yeah, full of energy, I'm sure. My wife would give just about anything to have a night away from our 16-month-old.
Yeah. Oh, yeah. You're in the exhausting time.
Tara, would you just tell me what's the appropriate title for you with your organization?
Sure. I'm the executive director of the Maine Association for the Education of Young Children.
Can you explain in a sentence or two, like what your association does?
Sure. We are a nonprofit here in Maine that focuses on supporting children and families from really focusing on the early childhood years, so birth to 3rd grade, as well as the teachers and staff that work in childcare and elementary schools, teaching and caring for those children.
Gotcha. There's no real government agency that oversees childcare and daycare prior to kindergarten, right?
Well, there is school, right? Within the Department of Health and Human Services in Maine, there is an office called the Office of Child and Family Services, okay. And they would be the ones that oversee things like licensing rules or we have a childcare subsidy program in Maine, so they oversee things like that for the birth to 5-year-olds. Okay, got it. So I may double back with them just once I'm done with our interview. I may just check in with them on all that. And also one thing that I just have been highlighting, if I'm talking to anyone kind of in media or communications, is that within this early childhood world, we really most often refer to programs as childcare rather than daycare. So that's just something to note. We've kind of moved away from that in the last 10 years. Okay, that's good to know, because I don't know that. It's funny, I actually used to work with kids as young as 3, but really they were, kind of 5, 6, 7, 8 age range. So I don't really know what the right term is. So childcare, thank you for clarifying that. I'll make sure that that's the term we use. So I reason I reached out to you is because I wanted to ask, how are our childcare facilities in the state, whether that's a family home childcare or a childcare facility that you might see as like a small business. Not to say the other ones aren't, but I think you know what I'm trying to say. How are those places handling vaccines, the COVID-19 vaccines, just given the fact that we know that younger kids are starting to become more susceptible to the more contagious versions of the virus, like the Delta variant? But obviously, it's very different than public school, where a district would mandate, hey, you've got to wear a mask, or you have to have a certain vaccine, which hasn't happened yet. But how are childcares handling all of this? So in Maine, we have over 1,600 different childcare programs, both home-based family childcare and childcare centers. And throughout the pandemic, they have gotten most of the regulations or recommendations or rules coming from our Office of Child and Family Services. That's looked like sometimes weekly, but then more often monthly updates on the situation and what is best practice. One of the most recent memos they got was on June 30th, which was notifying them about the end of the civic emergency in Maine, and that children no longer had to wear masks in childcare, but that the CDC was still recommending it. There hasn't been anything that I'm aware of since then to update that guidance. I would guess that something would be coming soon given the Delta variant, but I guess that was more of a long answer. In a shorter answer to your question, there is no one way that a childcare program is handling this situation. Some programs are requiring all their teachers and staff to get vaccinated, some aren't. Some are still requiring mask use indoors and some aren't. So it varies from program to program and region to region. Now, is it up to the program and their kind of their leadership to make that decision, or is it up to the Office of Child and Family Services to issue a guidance or a requirement?
due to the most recent guidance being lifting restrictions as of the end of June, right now it is up to the program. So in the most recent guidance that programs received, the part that was there about vaccines was a couple of sentences that basically said Maine residents ages 12 plus are encouraged to make an appointment at a vaccination site and a link to vaccination sites. There wasn't anything further in their guidance about vaccines and whether or not to require them and how to do that. I find it, it's an interesting time to be talking about this, given that the state has just decided to require it of healthcare workers. And I noted today that in the Mills administration's press release and in Governor Mills' statement, she talked about the importance of Maine people getting vaccinated and that doing so could save their own lives, the lives of their family members and friends. And then she closed that statement with saying, or the life of a child not yet eligible for a vaccine. And so I think that just puts that kind of question out there. Are we going to see any follow-up related to the people who spend the most time with children outside of their homes, the teachers and staff who work in childcare programs in elementary schools, of the kids who can't be vaccinated yet?
Have you heard from families who are concerned about sending their child to daycare without knowing whether the staff is vaccinated or whether the parents of the children that are also at that childcare are vaccinated?
I talk more often with the teachers and directors within the childcare programs themselves than I do the parents. What I have heard this summer and so far is the majority of programs have constant ongoing communication back and forth with parents. They're answering parents' questions, addressing concerns, and they've put a lot of things into place over the last year to try to mitigate risk. There are programs that are requiring vaccines. Every program that I've talked to has gone to lengths around cleaning, social distancing, getting kids outside more, continues to do that. And a majority of them actually have even changed up their routines and materials to try to maximize time outside, especially in the summer for children in Maine. So I do know that there's a lot of discussion about that. I think one thing that's important to highlight here is that there's this balance. I think we were finding this around Maine during COVID, around vaccines as well as other COVID precautions, is who is the decision maker on an issue and who has to enforce the rule. And I know that with childcare programs being small businesses, they often really like the ability to make their own decisions about their business and about their programs. Yet I heard from many of them in the last year that when it comes to a large public health crisis like this, they appreciate the most guidance and rules and mandates as possible to ensure safety, because at times when it didn't seem to be coming or it was delayed, it left directors and owners in times of confusion and uncertainty, trying to make decisions that are really heavy and weighted when it's the health of the children in their care. So, when it comes to public health measures, most folks who've reached out to Maine AYC this year have said to us, anytime there's really clear rules or mandates from our state leaders, we appreciate the clarity, we appreciate the details, and appreciate having something that's consistent across the board, so that parents aren't confused when they hear one program's doing one thing and another one's doing something else. One other thing I'd like to note about that too is we found throughout this year that any type of rule, whether it was around vaccines or masks or something else, has gone the best when there's good alignment between our Health and Human Services Department and our Education Department in Maine. Because on the ground, children go to both places, sometimes the same children and siblings in the same families, right? So you may have a second grader who's going to a childcare as part of their after school programming, or a 4-year-old and a 7-year-old who are attending 2 different places and coming from the same family. So I think that's also something when we're looking at vaccine policy, we're hoping and expecting to see that whatever comes out around elementary schools and K-12, similar rules that align will come out for our childcare programs.
You talked a second ago about how it's been helpful for staff at childcare facilities to have clear guidance from a government agency. You were also saying a second ago that the last real guidance you guys got was at the end of June. So it's really been about a month and a half since any update. Is that leaving you guys in a position of kind of uncertainty? And I don't want to put words in your mouth, but almost frustration around not having some clarity about what to do with all of this for staff, kids, parents?
I haven't heard from any, so we not only are a nonprofit, we're a membership association, so we have a lot of members of our organization. I haven't had members reaching out recently with a lot of confusion, although it really is only in the last few days that we've heard questions coming up around vaccines. I've noticed throughout the pandemic that when I start to get an influx of calls or emails on an issue, it usually is within that week that we hear something from the state. So I'm very hopeful that something will be coming out in the coming week, especially with, even though childcare programs mostly operate year round, there is, I think as this back to school time with elementary and middle and high school comes up, there is a sense of just wanting to make sure things are aligned and clear for all families in both locations. So we would be really, I think there would be frustration and disappointment if there wasn't something out within the next couple of weeks, just because the news every day keeps, getting a little bit more alarming around the Delta variant and some of the questions that arise around kids who can't yet be vaccinated.
Well, and because you guys need time to plan, as simple as that, right? Put those
Right.
measures into place.
Yes.
I mean, as somebody who is an educator, somebody who has once sought childcare for your own kids, I'm sure, can you share kind of what thoughts and feelings go into a time like this for a parent trying to pick a childcare, and what advice you might give them if a parent is concerned about vaccine status at a child care facility or family child care home?
I would recommend to parents that they are really upfront and honest and share any concern or question that they have with the teachers, staff, directors, owners, all the people that they work with in childcare programs, not only because that is helpful with just having a positive, really collaborative relationship around the care and education of your child, but also because often those directors and those teachers can share that information with supervisors, with state officials, with others. So if they are hearing growing concerns from parents or new questions coming from parents, they'll then share that, and that can help the state to make decisions as well. So it's really important that as a parent, I have kids in elementary school now, and I look at it, it was just as important then as it is now that we stay in touch and we have really good communication. So we're not just sitting at home getting frustrated and having those frustrations grow.
Can you kind of put yourself back, back into your shoes from, I don't know, almost 8 years ago when you were looking for childcare for your kids, and imagine trying to do that today, and what kind of thoughts and feelings, oops, sorry, there's a bug in my face, some thoughts and feelings that you might be experiencing, or you can imagine other parents might experience right now. What might those concerns or thoughts and feelings generally, even if it's not a concern, what those might be?
Yeah, I can understand for parents, I'm a parent too, that this past year and a half has been one with a lot of stress and anxiety and confusion. And especially when this pandemic first started, I think we all had a lot of questions about, was a group setting going to be okay for our child? And what did it mean? I mean, the weight of a parent not knowing if you're making the right decision or not is heavy, and it's hard. I think what helps me feel better is knowing that the teachers and the staff and those who care for and educate my children, whether it was when they were 1 and 2 years old or now when they're older, are also grappling with the same decisions and doing the best they can to create a safe and healthy environment. And so I would say, share your questions, share your concerns, and one of the questions I would ask is about anything related to distancing, masking, and time outside, and what those things that childcare programs have been implementing all year are still in place, so that you can kind of see your comfort with what your childcare program is doing.
I mean, can you, is there an added stress that comes with the fact that kids under the age of 12 cannot get the vaccine, you think, for the staff or for a parent trying to enroll their child?
In the early months of COVID, this was one of the things we talked about most in the world of childcare, because unlike some settings with older children, you cannot distance from young children. When you are teaching and caring for them, you're changing diapers, you're helping with noses and shoelaces and all kinds of things. So that is not an option. And even though masking was implemented and some distancing was implemented, it just can't happen all day when you have 2-year-olds, 3-year-olds, 4-year-olds, right? So I think what has helped those who work in this field is being able to, first of all, when vaccine access opened up, teachers in childcare were prioritized along with those who work in K-12, so they could have quick access to vaccines. And then to be able to see that this wasn't, I mean, I do not work obviously for the CDC and I don't know all the details, but when I think about the messages we got from the last year, what we heard over and over was that the youngest children seem to be not getting as worse cases and also not transmitting it as often as older youth and adults. And so this alleviated some concerns. But I will say childcare programs for the most part stayed open. Those that closed reopened, and these predominantly women who earn low wages and have very few benefits have worked on the front lines of the pandemic this entire year. And so I really commend their perseverance and their dedication to children and families in Maine, because it's working through a time that's had a lot of uncertainty, and putting yourself at risk to do that and to make sure families could go to work and children had healthy, safe places to be. So I'm hoping from our state leaders that we continue to see good communication. We need it to be quick and clear and as detailed as possible anytime things shift, because the childcare programs need time to implement changes and to make sure they're at the front of any new rules or recommendations that are important to keep children safe.
Is there any agency, I don't know if it would be your association, that would keep the vaccination records of staff at childcare facilities? Or no?
You know, that's an interesting question, because we have been wondering since the announcement was made a couple of weeks ago that the state of Maine is going to be kind of keeping a database of information on teachers and staff in K-12 and updating it on vaccination rates in communities, whether that would include teachers and staff in the birth to age 5 or the childcare sector. And I haven't heard whether that is taking place. I think it would make sense for communities and families to be able to look up both. It's a little bit more difficult, I think, when I'm thinking about privacy, to take a large school district versus a small childcare program, but maybe there's a way the state could pull the data together in regions.
Yeah, and also the fact that, you know, kind of as you mentioned, right, you know, there are school districts that are public, right, taxpayer funded, whereas there are childcare facilities and family home childcare centers that operate as a private small business. So
Yes.
yeah, I guess that's a little bit tough, right?
It's a little bit different. They are, we're talking about sole proprietorships and also nonprofits. They're all different types of business structures. They are also regulated by the state. So the state does have input into, you know, programs are licensed by the state, licensors visit, and there's also other programs and services that provide funding to childcare programs like the childcare subsidy program. So that does mean the state has a role to play. And I think particularly, you know, in a public health crisis like this, because the state's role is really about the health and safety of children. And so that is, you know, what this is all about when we're talking about COVID-19.
Okay, so this might be a little bit out of left field, not out of left field, but it might be a little bit of a stretch. So just, you know, back me up if it's unrealistic. Is there any way that a childcare facility, you know, would say, okay, hey, we're going to ask, that if you want to enroll your child here, you, the parent, have to show that, you both are vaccinated, or wherever your child spends, the kind of pie chart of their time, whether it's mom's house, dad's house, whoever's house, that these people in the family are vaccinated. Is that realistic? Do you think that would ever happen, or am I crazy?
Well, I haven't heard that as a policy yet that a childcare has decided to implement. It is definitely within their purview as a small business and as a entity unto themselves to go beyond whatever the state is requiring and choose their own requirements. I think, they're probably going to weigh what they have the ability to enforce or to oversee. Many times when we're talking about a director of, say, a childcare center, they are, name all the hats that a school principal wears. It's the same thing, right? They're a counselor, a custodian, a teacher at times, all the different roles. So it is a lot to take on. I am interested to see as we move into the fall and more businesses are adding these requirements around vaccinations, whether our childcare programs and schools may come together around some kind of choice, like you could either show a proof of vaccination or you could show some kind of regular COVID test that you get, just the way schools are looking at pooled testing options. That's more difficult when it comes to childcare because sometimes we're talking about 20 children and a few teachers, but they can choose to make those decisions. And I wouldn't be surprised if we get into higher risk time in Maine with cases going up, if people look to be innovative and find ways to require vaccinations in different ways, just to make sure that they can stay open and protect their own health. And, that may become a particular conversation between family childcare programs, because during COVID-19, the most common thing we heard from family childcare professionals was the difficulty in deciding whether to open or close because it was their home. And so they were going to be exposing themselves and their family to COVID by running the childcare out of their home. And often they're serving 6, 8, 10 children. So they may be able to set up a policy with a very tight-knit group of families that have, that trust and relationship in a way that's easier than a larger childcare facility.
Understood. Tara, you have answered all of my questions, even though some of them were a little crazy. Is there anything that we didn't cover that you think I've missed that I should have asked you about, something that you wanted to get across?
I don't think so.
Okay.
The one thing I knew I wanted to bring up was just kind of these two, K-12 and birth to 5 are always treated separately. And we've been talking a lot in the last couple of years about how we need to have more and more discussion and policies that make sure the two worlds align. And I think COVID-19 just really made that more urgent, because children and families don't just go to one place, they go to both. Teachers in public schools have kids who are in childcare programs and vice versa. They're just very intertwined.
Yeah, totally. Well, I really appreciate you taking some time. I really do. I'm probably, what I'm going to have to do, so I told you I'm off tomorrow. I'm probably going to work on this on Monday to try to get Child and Family Services to give a response of some kind. Also, I'm probably going to try to reach out to a child care. If you have any recommendations in the Southern Maine area, I'll take them. And I'll show you, because I hate meeting people for the first time on Zoom. This is what I look like without a mask.
Okay.
This is my little kiddo.
Oh, so sweet. Oh, yeah. She's so cute.
Thank you. So yeah.
I will, I'll email you with a few possible people you could reach out to. Is your office in Portland?
It is.